For this discussion, I will be talking about health disparities among Native Americans. Native Americans in the United States have the Indian Health Services, but 13.2% of Native Americans still report being in fair or poor health compared to the national rate of 9%. Um, Health disparities and inequities exist in every form, including social and economic issues that can lead to other health disparities. A study found, for example, a study found in 2015 that Native Americans were more than 2 times likely to die from diabetes and chronic liver disease and cirrhosis than compared to the total US population. And along with physical health disparities like that, Native Americans also experience mental health disparities, including higher rates of PTSD and higher rates of suicides and higher rates of substance abuse disorders than the general population. This isn't a new trend. This has been happening since Native Americans were forced to integrate and conform with colonizers' way of life. Um, this and these disparities exist because of that abuse, including um, the settlers bringing in unknown diseases, violent conflicts with colonizers, forced removals from native lands, forced integrations of their children into schools off reservation, therefore breaking up families, and then continued racial abuse in healthcare settings. This abuse leads to social challenges like violence and trauma to be more prevalent in Native American populations than the general public. And also, as disparities continue to exist in these Native American populations, research needs to be done. However, the population is relatively small to collect data from, so research isn't funded properly, and also the IHS is not funded properly at all either. Uh, the IHS, like my recommendation for solution would be the IHS being funded more in both facilitating and providing healthcare and also the research behind Native American health disparities. Also, increased funding for education and general quality of life could lead to more job securities and other economic developments within communities. Um, and more public health education programs could be implemented to discuss how all areas of health and wellness are connected and how it's culturally relevant. And if the healthcare system won't change for Native Americans, then public health and government officials need to provide culturally relevant public health interventions based on research that's already been done and increase social services to create equitable opportunities for Native Americans to help combat the continued progression of health disparities.